Every time I see someone in the black community who is overweight, they always say that it's their glands acting up. Well, today we're going to talk about those glands. The scientific name for those glands are thyroid glands. The thyroid is a small gland in the neck, just about right there. It is extremely important because it affects every organ, tissue, and cell in the body. It makes hormones that help to regulate how the body uses and stores energy from foods eaten and organs functions. When the thyroid is not working right, it can affect your body weight, energy level, muscle strength, skin health, menstrual cycle, memory, heart rate, and cholesterol level. See, I told you it was extremely important. The thyroid can be underactive, overactive, or just be enlarged. If you have thyroid enlargement, it can actually be underactive, overactive, or have normal function. All of these things can be problems. Thyroid disorders are much more common in women than in men, and 1 out of every 8 American women will develop a thyroid disorder. So what are the different types of thyroid disorders? First, let's talk about hypothyroidism, which is underactive thyroid. This is the most common type of thyroid disorder, where the thyroid makes too little of the thyroid hormone that your body needs to function properly, and also the one that makes you gain all that weight. It is most often caused by Hashimoto's disease. With this disease, the body's immune system attacks the thyroid and tries to destroy it. When damage is done to the thyroid, it can become larger, called goiter. Not getting enough or getting too much iodine in a person's diet can also cause hypothyroidism. Not getting enough iodine is more common outside of the United States. Being female, over 40 years of age, having a close family member with thyroid disease, and recently having had a baby are things that can increase the chance of getting hypothyroidism. Next, we have hyperthyroidism, which is when the thyroid gland is overactive. It makes too much of the thyroid hormone that the body needs to be healthy. This condition affects more women than men. In young women, hyperthyroidism is most often caused by Graves' disease. Sometimes the eyes can seem to bulge out when you have this Graves' disease. With this disease, the body's immune system tricks the thyroid into making too much thyroid hormone. The entire thyroid becomes enlarged and overactive. Older women may get another form of hyperthyroidism, toxic nodular goiter, where overactive thyroid cells group together and form a lump in the neck called a thyroid nodule that makes more of the thyroid hormone than the body needs. Some thyroid disorders initially cause overactive thyroid, but at a later point in time cause underactive thyroid due to the damage done to the gland. You can also get cancer of the thyroid gland. This type of cancer is most often found as a lump or nodule in the thyroid. It is not a common type of cancer, and most thyroid nodules are not cancer. Other signs of thyroid cancer include swelling in the lymph nodes of the neck and trouble swallowing or breathing. Although anyone can get thyroid cancer, people who as children who had head or neck x-ray treatments for tonsillitis or other conditions are more likely to get this type of cancer. It's generally treated with surgery, which removes the cancer, sometimes followed by radioactive iodine therapy, which kills the cancer. Just like any other cancer, the most important thing is early detection. So if your body is telling you something, you better listen. Please go to our nutrition section to see which foods are rich in antioxidants so that you can avoid cancer altogether. I'm your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.